is to really show you the great work that the Nottinghamshire Safeguarding Adults Board has undertaken this year as part of the 3-year plan. I think for me as the cabinet member, what's key is the fact the board's reacted to current events. For example, when the Panorama show exposed the abuse at Enfield Hospital, and the work that they're doing to relay, the work they are doing to try to reassure the public in terms of the issues raised there and across the sector. So I'd like to thank Scott McConnelly and the entire board for the work they've done, and I'll hand you over to Scott as the independent chair of the board to take you through the report in more detail. Thanks, Scott.
Good morning, everybody. So I'm Scott McKechnie. I'm the independent chair of Nottinghamshire Safeguarding Adults Board, and today I'm here to sort of present the annual report for 23-24 and take any questions. So we've prepared a paper in advance as part of your papers, and also provide you with the annual report, which has now been published. Just a reminder that the annual report is a statutory, or the board sits under the Care Act, and in particular the three main priorities of the board, which are statutory, are to provide a strategic plan, which actually comes to an end at the end of this financial year, publish an annual report, which you've got as part of your bundle, and undertake any Section 44 Safeguarding Adults reviews, which I'll cover a little bit later in my report. So the work of the board has continued to focus on the three main aims, which is prevention, assurance and engagement. I think it would be remiss of me not to make mention at this time about some of the budget and workforce pressures that are going across the safeguarding system, particularly around our partners, which are police, health and social care, but the knock-on effect that has on many of our members of the board. But I just want to reassure members that senior leaders and staff are continue to work extremely hard in this arena. So moving on to the report. So one of the aims of last year was to create a communication subgroup for the Safeguarding Adults Board. That has now been created. Recently had, not in this reporting period, but recently had a 3-year communication engagement strategy created, which looks to both engage with the professional workforce, but also out into the community about matters which are of significance to adult safeguarding. We've also linked in with many of our partners, obviously crossover from county and to city, so that communication engagement will be jointly with the City Safeguarding Adults Board. Board membership continues to be under review. We will always do that and continue to do that annually. We've had the membership now, which has enhanced the board from Department of Work and Pensions, Carer Federation and Power, our advocacy service. This communication subgroup this year, we promoted elder abuse awareness and the joint carer strategy, which has been issued in the county. And I'd probably just like to highlight to you one particularly good piece of work from our partner in Nottinghamshire Fire and Rescue Service on page 11 with their Charlie P pathway, which has been linked across our subgroups and out into the professional network. And you can see in the report how we make a link to our own training in particular, which is around difficulty in engaging with people. But I just thought I'd highlight some of the great work of our partners there. Increased participation with people with lived experience. One of what Councillor Wheeler referred to, is that one of our aims as a board in this reporting period is to improve our understanding and engagement with many of our mental health inpatient settings. So through the work of the board with our partners, we've created, or ICB have created in particular, a mental health quality and safety group, which supports a space with open conversations, challenges and best practice can be shared from independent hospitals, commissioners, Queer Care Quality Commission and members of our board who attend that. It's been a really positive step forward for some of those what people would refer to as closed culture hospitals, and I do see that as a real positive implementation this year to allow that more free flow but also accountability within those settings. One of the things that we'll continue to do with that board is look to improve our understanding of how the speaking up or the whistleblowing protocols are used, and also the complaints in those settings to see how those particular settings and providers are reacting to and reassuring us of their response, particularly around whistleblowing or speaking up. We have voice of lived experience is something which in adult safeguarding, and when I say adult safeguarding, I'm particularly focused on people who've gone through the safeguarding processes. So we're looking to establish more engagement with people with lived experience and looking at how we can engage them to help us shape our services with co-production potentially of future policies, procedures, approaches, but also the participation in our board. So we're looking to do that. We have a task and finish group in place. This is different to the Your Voice programme that the local authority have. This is more focused on safeguarding. So I'm hoping we can provide an update on that next year as to how that's progressing. So quality assurance and performance monitoring. We continue to have our quality assurance subgroup, which reports in from the quality marketing management team. That's particularly around home closures in Nottinghamshire and how they've been managed and what that intelligence picture is that's coming in between that team and the QC around any safeguarding matters within those settings. We are looking to we have developed a relationship with Watton Prison. We're looking to develop a relationship with other 2 prisons in the county, and we have done with one around supporting them with adult safeguarding training, particularly with the changes that have come into play over the summer with the SDS 40 to try and ensure that they are thinking about both the safeguarding within the setting, but also any impact out into community when prisoners are released. We continued our engagement with the Circle, which I updated on last year around their assurance, around some of our asylum seekers and refugees. And we have had a recent update from them at the board, and certainly board members were assured by their response, but also how the numbers have actually reduced significantly in the county. We have one of the areas that we continue to work hard on as a board, and that links to what I'll cover later on in one of our Safeguard Adult reviews that was published this year, is about our connection with the Rough Sleeper Initiative coordinators, using that experience of severe multiple disadvantages to try and develop services for those particularly vulnerable members of our community. We will continue to work on, and we're quite advanced now in our transitional safeguarding arrangements. This is work jointly between adult pathways, but also children's pathways for safeguarding, to develop a more cohesive approach to transitional safeguarding arrangements for those children who maybe don't sit within the current cohort of transitions that are available. And that's particularly looking at some of our most vulnerable children who may meet a cliff edge at the age of turning 18. One of the big pieces of work that was done by the board this year was a Making Safeguarding Personal survey, which is circulated across all partner agencies. It's the first anonymised survey of this type undertaken between the boards, and responded to by just under 400 professionals across 27 services. We received very good assurance, with 97% saying they received safeguarding training, 95% knowing where to go to raise concerns, and 95% expressing confidence to be able to recognise abuse and neglect. But also, in addition to that, over 95% saying they're aware of their freedom to speak up of whistleblowing policies within their organisations. Data is recorded overall. We've seen a 50% increase in the number of concerns, just under 10,500 raised in the multi-agency safeguarding hub. That trend reflects the national picture, and most of our data in this respect does reflect the national picture around the 3 most common types of abuse being neglect, physical and organisational abuse, and on home residential care, and in the community the 3 most common places that it takes place. There's been some improvement in the figures for making safeguarding personal, so that's questions that are asked at the end of an engagement with someone under the Section 42 of the Care Act, with that increasing from 93 to 95%. I know that's a particular focus for social care staff. So we have a new executive group which we created. Excuse me one second. which sits alongside the board. And that's the three statutory partners in the main with the subgroup chairs, and we do have robust discussions between the statutory partners looking at any risks that are materialising. One particular area that we have focused on in that group is the Nottinghamshire Healthcare NHS Foundation Trust response to CQC reports, but also the tragic events that took place in the city last year. We have received assurance directly from the Trust. We are now cited on their Improvement Oversight and Assurance Group, which is leading the Trust response. I understand you had the Chief Executive, I think, at this last time it met. And I've personally met with the Chief Exec and the Chief Nurse to seek assurance around the involvement of safeguarding across their improvement journey. We now have the governance of a monthly update to myself and the adult board chair in the city from the deputy chief nurse and the head of safeguarding from the trust, providing us an update. And also the board is provided with updates via the deputy chief nurse as well. So that is and will remain a focus for us in the coming year. So in terms of our training offer, one of the things that we'll continue to focus on is our training. For example, we've completed 9 understanding safeguarding concerns sessions this year. We will continue to focus on raising safeguarding concerns, difficult engaging, domestic abuse training, and that incorporates coercive and controlling behaviour. So we'll continue to do that, and the board has a suite of 7-minute briefings which have been developed and added to over the year for professionals to use. And then finally, before coming on to next steps, safeguarding adult reviews, page 28, 29 and 30 of our report, I'm not sure what is in the bundle. You'll see details of what we reviewed, but also what we published this year. So we've got 2 mandatory safeguarding adults reviews which were published this year, both very sad cases that are on our website, but we followed the process of a safeguarding adult review and published the learning, which is on our website. M22, the main areas of focus there are around demands in the community on community services, Mental Capacity Act, equality, multi-agency meetings in particular where severe multiple disadvantages are identified, care coordination in the community, risk assessments upon release from hospital, carers assessments, and difficulty engaging with people. And N22 had some of this related to a sad death of someone who was rough sleeping. But one of the areas they focus on there is exempt housing providers. The new Act is in place, but the regulations that come with that are not quite published. The referral pathways for people who are rough sleeping, Mental Capacity Act, multi-agency meetings, which in particular the development of complex case panels or vulnerable person panels in districts, and then joined up solutions to support severe multiple disadvantages. So one of the areas that we'll be focusing on the board in the coming year is the response to those safeguarding adult reviews and task and finish groups are already established and what plans are underway. So just to finish off next steps for the board in the coming year, much of it is underway. We have so we continue to develop our attempted engagement with people with lived experience. We'll continue to focus on our communication strategy. In particular, this next focus on advocacy service and making sure that those people who are entitled to advocacy services get them, transitional safeguarding, training, severe multiple disadvantages, and continue to work around those independent mental health hospitals, and then the continued improvement on oversight assurance from the trust. And the final part is that our strategy is due for renewal. So as a board, we'll be meeting in January to develop a new 3-year strategy. So that's the highlights from the report. And
so thank you for summarising. Say anything? Oh. Right, in that case, I move the recommendations as detailed in this report, and I seek a seconder.
Yeah, I'll second that.
Seconded. I'm now going to open the floor up for debate. Mike.
Thanks, Chair. Thanks, Scott, for the report. As always, smashing to hear that the board's increased. With it. I'm not sure how I scrutinise it as a committee. I would scrutinise the board, other than just look back at the results that we're given and provided with. Is that going to be a channel that we can use? I've raised that before, actually, as to the direct scrutiny of that. Just one more. I've got several, but I think there's a lot of words in the report that don't allow for scrutiny, to be quite honest, because they're quite vague. However, it says about continuing engagement with Serco on an annual frequency report. Second question is, do you think annual report from Serco is enough? Thank you, Chair.
So first one about engagement. I met with Councillor Wheeler recently, and Councillor Wheeler receives the minutes of the board and the executive, or the board in particular, and is welcome also to join the board. So that's one thing, that engagement. So the lead to that will be available to attend. And in terms of Serco, so Serco do two things for us. One is they complete our performance assurance tool, which is kind of self-assessment that is completed by organisations. You'll see that referred to in the report. So they complete that, but they also, as well as completing that, we invite them back for following the work that we did with them. We invite them back annually to give us an update on what their data is telling them, and any. In terms of the assurance and scrutiny, the safeguarding processes that we have in place, if it were to identify any other issues that were in that particular cohort of people, then that would feed through into the board through our quality assurance or SAR subgroup around raising any concerns we've got, both in terms of any Section 42 inquiries that were coming in, if there was an escalation in the numbers. So I'm assured that, yes, it is enough for us, and if there was something that was of a particular concern, then the board can divert itself to that where it was required. A bit like what we did when it was raised at this group initially, that we went looking and asked lots of questions on your behalf as a committee, providing that scrutiny, because I very much see that as part of my role, is to provide scrutiny as well on your behalf if it's required.
Councillor Pringles just asked one of the questions I was going to ask, but there you go. The other thing that I was wanted to query was to do with the whistleblowing and complaints information requested by the board. What has been learned from this, and are there any themes or common complaints, and if so, what are they?
So that relates to the work we're doing with the what we refer to as closed cultures. We're still waiting on that information coming through to us, so it's been requested, and we're still waiting on that coming through. So we're actually taking that. I've written to the different organisations through that oversight group that we're still waiting on that data, so I can't provide you any updates. But that's one of the key themes for this year ahead, is to get that information, analyse it, and see if there's any themes that come through. But more importantly, I think the key thing for us as our board is to get the assurance that when whistleblowing reports or freedom to speak up reports are raised, which is often the way in which serious abuse and neglect is detected, is that they're dealt with appropriately and robustly by the organisations themselves. So it's work underway, and I'm hoping to update on that in this coming year's report.
Thank you. It's clear from the report that there's a marked progress demonstrated, so that's really excellent news. One area of concern I think that people will have, and I certainly have, is the worrying 35% increase in safeguarding concerns. We're given a lot of information, but what we're not given is where those concerns, geographically, where those concerns within the county are coming from. And I think I'd find that helpful to know what was happening in my division around it. I wondered if we could perhaps get hold of that information at all.
Yep, so we can provide that. So Ainsley is responsible for the MASH. So the Adult Safeguarding Board will look retrospectively at data and themes and understand any trends. But we do have that within the service, and we see that monthly in the organisation. And it is very similar themes. So safeguarding activity happens where deprivation is predominantly. So it will be around our urban centres, so not exclusively, but that's what we see. So Mansfield, Ashfield, and Worksop are where our highest amounts of safeguarding activity are. And we have seen an increase in the last 2 years, particularly in financial abuse of older adults, which isn't surprising given the financial conditions that we're in at the moment. So, but yeah, if you want to have a detailed report, I'm sure Ainsley can circulate something after the meeting that just gives a sense of that. But it's not surprising data, really, given what we know about our population.
That's interesting what you say about finance, because the first time since I've become a county council, I've come across not one but 2 instances of cuckooing, where people move into somebody else's house and they pretend that they're living there, but they're not really welcome there, that is a worrying trend as well.
Yeah. So I mean, yeah, the police that's something that the police manage on the board, and but they are aware of that, and they do have a focus on county lines, and I know that translates across children and adults in terms of the exploitation of vulnerable children, but also adults, as you refer to in cocoon, and that that they are also a group that are difficult to engage, and that's why we have that focus on difficulty engaging training as well. So it's I think that the key in terms of an operational response, then it's important that members of our community and anyone who becomes aware of that reports it to the police, and if there isn't a response to that, then that needs to be raised into to the system to understand that. I know they have risk assessment conferences around exploitation, both in the city and in the county for children and adults.
Thank you, Chair. So my question is relation to page 16 and 18 of your report, particularly about the assurance. I'm not completely assured, so let me just ask a few questions on that. So on theme 2, it talks about a task and finish group being set up to identify how best to involve people with lived experience of adult safeguarding in board activities. It mentions it will take some time to actually fully develop this. I suppose my question is, do we not already do this and have this? And why is it taking so long to actually develop? Second question is regarding the assurance and Serco group. I know in the on page 16 it talks about how you've already actually addressed how you go about this assurance. I must confess I'm not completely convinced that just taking their word at it is the best way. I'm just wondering, do you consult with anyone else, and particularly district councils, county council? As I suspect it might be different within different locations of the county. And in terms of what you'll be focusing on next year, 24-25, obviously we talked about this lived experiences bit as well, but also the development of the communication and engagement strategy. Again, it's saying you're taking time this year to really develop it. So I suppose my worry is that there's a lot of time actually getting these things set up, but then by the time they're set up, years past, you've got to take another year to actually suss out if it's actually working or not. I'm just wondering, in terms of assurance, can we try and get these assurances a bit quicker and in the detail that we'd expect to be reassured? Thank you, Chair.
Okay, so to deal with voice and lived experiences, that is not an easy task to complete. I have to say, and I am very, I'm sure others that attend the board will tell you I am very much focused on how and when we do things. But there is something called participation ladder, which shows that, and we had our partnership event last year this time last year during Safeguarding Adults Week on co-production and participation, and the message that came shining through from the experts in that field is that this is not a quick win. When you say we have that information already, we the making safeguarding personal aspect of the Section 42 inquiry, which is the information at the end. Our plan is the questions that are asked of somebody who's gone through that. Our plan is to, and this is what we're talking about here, the work potentially with Health Watch is to engage some of those peoples, but it's understanding what the right communication pathways are with those individuals, and whether that's through text message, is it email, is it phone call, is it somebody else that makes contact with them, and then thereafter, if we're going to be doing engagement with them, it's got to be meaningful and long term. So I apologies on behalf of the board, we haven't achieved that, but it isn't an easy task for us to do. And we will continue to work hard on that and try and develop, and even if it's an iterative approach, trying with certain individuals. I set myself a target to try and get people engaged in the development of the new strategy, but we aren't quite aware of that. And it isn't an easy one to do, and it's a different cohort of people to because the Director Adult Social Care will tell you about they've got quite an advanced group of people providing what's called Your Voice. But it's a different cohort of people, and actually, when you think of the cohort of people that we are focusing on, it's those that have suffered abuse, neglect. So we've got to be really careful about how we engage with that group of people and how we approach the communication with them. Circle. Myself and the board manager, we attended one of the sites with them, met with staff, took an understanding of both what their data tells us. So they've enhanced their data since our engagement, so much so that when they presented to the board at the last board meeting, they were able to break down into the geography of the county. And actually, I think it's Broxtowe is the only place that has numbers that are into the sort of teens now across the whole of the county. So we looked at what training packages they provide to their staff, but also the data, but also went to one of the sites. So I think that's quite a lot of activity in there. Maybe it doesn't say it all in the report because we try and keep the report strategic, but that's some of the sort of practical engagement that I took, personally to Circle with the board manager, and then updated the partners on the board, because strategic partners are also ones who decide how far we go with what we do, and they felt assured. And actually, what we achieved was an open and transparent approach to that by Circle as well, who were looking to improve how they recorded their data, but how they improved their own training in response to it. So the final question was about assurance. Does that answer that? I think maybe
the other one was just about, I think, just the general communication and engagement strategy.
Yeah. So that's something
I think you've almost touched that.
Yeah. So they meet 4 times a year as a subgroup. So we have got now a published strategy. So when I am particular, and I know Direct Adult Social Care support me in this, is that we're now looking for action to take forward. And I know they did a lot of work around the launch of the carers. I'll get the name right so I don't get into trouble for them. The carer strategy that was produced. So, and then the next phase of work is about advocacy to make sure that people and families know about when somebody's entitled to advocacy support.
Essence, and time is moving on.
Sorry about that. And thanks for the report, Scott. Now I've had my wings clipped a little bit, but I'm interested in the page 14, para 5 in relation to whistleblowing, because I'm a big advocate for having structures and things in place where people feel supported and are able to speak up and make complaints, not only staff but service users as well. So it's an interesting point for me in relation to the survey that's being undertaken or has been undertaken with Health Watch. Can you tell committee what you've learned from that, and can you tell us if there are any common themes running through the survey, and if so, what are they? The other thing I wanted to ask, Chair, is in relation to the work that you're doing with the Watton prison, Watton and other prisons in the county, because there's been a lot of anecdotal evidence about prisoners having nowhere to go when they've been released. And is this something that factors into your thinking around social isolation and rough sleeping? Because it's an interesting thing. I've got a few more questions, Chair, but I'll leave it at that. Thanks.
Thank you.
As I said to Councillor Field, we haven't quite completed the work around. We haven't quite completed the work around freedom to speak up or whistleblowing, but I share the same view as you. It's really important information. I think what was reassuring for us, the respondents in the Making Safeguarding Personal survey, over 95% said they were aware of the internal processes. And also I'm aware that CQC, the Care Quality Commission, have now got their own, they're very much intelligence-led with their process of any whistleblowing reports. So when we get that information, as I said to Councillor Field, we'll keep you updated around that. Yeah, in terms of the prisons, yeah, I mean, the prisons are governed in a different way. They don't fall under the Care Act in the way that organisations and communities do. So a lot of the support we do is being a supportive partner to them in terms of enhancing their safeguarding training both within the prison service, but often more recently with Loudon Grange, for example, is about supporting both thinking about the safeguarding within the prison setting, but also identifying what the care and support needs that someone will have when they leave prison, which is what this particular, some of the issues you raise there are wider into district councils and not just under the safeguarding adults arena.
Councillor Butler.
Thank you, Mr. Chairman. This is linked actually to the communications and engagement, and this might be a very naive, simple question, but very, very comprehensive, very interesting, very glossy report, plainly aimed at the professionals and our partners. But I assume the public get to see this as well, because there's a reference on page 31 on how to report potential safeguarding worries. Where does it go? I mean, we print. I mean, I assume we print lots of copies, and are we confident it's getting to all the right places for people who might need the service to actually get it? So, are we confident it's getting out to the very people, obviously not just the partners, but the people who actually might have issues and problems?
Yeah, it's published on the Nottinghamshire Safeguarding Adults website. So it's publicly available, so anyone can search and find it, and we also share it across with our partners.
So do we have? I presume we have printed copies as well. Do we, to go in libraries and such like, or anything, or maybe not? No.
Councillor Curry.
Mine's a very quick one. Page 25. You've got figure 8, primary support reason. Interesting that the fourth biggest segment on that pie chart is not known or blank, and that's about 12.5% of the numbers that engage with. You don't know the reason why, so are you looking to improve on that, and how?
Well, yeah, of course, anywhere we've got figures like we'll look to improve, and that will be in particular through the Multi-Agency Safeguarding Hub, who report that, but I know there was a switch to a new system which took place about this time last year. So that might be because some of the data even were recorded. The annual report is we're expecting different quality of data for next year's annual report, particularly around the responses to Section 42. So yeah, we will take a note of that, and wherever possible, we don't like to put that in reports, but unfortunately that can be as simple as someone not ticking a box on a referral form.
Councillor Matt.
Yeah, I'd like to go back to the question that Councillor Henshaw asked actually about prisoner release across the county. You know, what role do we actually play in that? And because that has a massive impact on rough sleeping when they're not looked after correctly. And I've got an experience of that recently as a resident of mine was released, and he could get no help from anywhere whatsoever. Ended up settee surfing on the goodwill of his friends, and that's usually what happens. And that's a real concern about rough sleeping.
So we're going to move on after this question. We're going to ask Miss Williams to respond.
So it's not in the scope of the Adult Safeguarding Board, but the prison release, I understand, is part of the Safe to Knots Board, working in the Crime and Safety Partnership. So yes, it's not within the adult safeguarding remit. In adult social care, we particularly have a role with when somebody potentially is being detained under the Mental Health Act on release, but that's the only small bit of the process that we're involved in.
Thank you very much, Mel. Starting to look at a further area for consideration.
So obviously the recommendation being moved and seconded. I think the only additional information that members requested that a breakdown of the safeguarding concerns based by geographical area is shared with committee members. So I think that was everything.
Have been moved and seconded. Can we have a show of hands, please? Thank you very much. That's unanimous. Item 5, I'm going to ask Councillor Jonathan Wheeler to introduce this report.
Thank you, Chairman. So, as colleagues will be aware, we work with a number of care providers to ensure we can deliver the care and support needs that our residents have. As a council, we've supported the market with extra funding through the Market Sustainability and Improvement Fund and an increase in the annual fees we pay, as went through Cabinet in March this year. The recent budget announcements has caused concern with the market, and I've been written to by the Nottinghamshire Care Association to outline concerns from providers that they obviously to work with. So we are working with them to provide support while we wait for clarification from the government on a number of issues, such as the national insurance contribution requirement from them and obviously how the compensation will be distributed, if anything. So I'll hand over to Katie to go through the report in more detail, Chairman. Thank you.
We're going to ask Miss Williams to comment and speak on the national insurance increases and minimum wage increases and how they're going to affect adult social care in Nottinghamshire and the consequences. And so we'll try and tidy that up before we get into the historic stuff that we're dealing with.
The Chancellor's budget has had a significant potential impact on the cost of adult social care as we understand it. So we think that the living wage, the blended wage packet and the NIC has increased by about 6% on top of all the usual amount we pay. So we usually pay about a 7% uplift to the market. And just bear in mind, the adult social care budget doesn't get increased by that percentage every year. So it's a huge impact, not just on adult social care providers, but also the voluntary and community sector. So Councillor Wheeler is correct that we've been working with the Care Association and our providers to understand their impact. And as a broader council, as we start to move into the budget process, we'll be having a look at our fee strategy. So Councillor Wheeler will present the fee strategy in February to Cabinet, which will look at how we can recognise some of the cost, or if not all of the cost of the increases. But it is a concern at this stage. We await the local government financial settlement, so we await for that to see if there's any mechanism for reimbursement within that settlement.
Thank you very much, Melanie. So we'll go to Katie for the historic report. Thank you.
Thank you. So the paper you've got gives you a broad overview of how stable and sufficient our market is, some quality indicators, how we engage and work with the market, and an overview of our external workforce, which is 32,000 people. And I think a really important message is that in Nottinghamshire we generally have a very stable and sufficient market, and if people need support and a service, they get it generally, which is really important. We have seen some turbulence in a couple of areas that has been reported here before, and I'll talk a little bit more about that. But you've got an overview of the fact that we work with over 430 providers that we contract with. That doesn't include a range of providers that are only supporting self-funders. This is about providers that we directly contract with. And we support about 12,500 people on long-term support. So you've got that overview information. In terms of quality, we have a quality and market management team. We work very closely, of course, with our operational teams to make sure that we've got live feed of information as people are undertaking assessments of people out on sites, obviously with providers. We also have a broader partnership risk-based approach to supporting providers and spotting risks in quality, where we work with our broader partners, health partners, fire and rescue, etc., and share lots of information all the time. But what you will see is a table of CQC ratings, and we have reported here before that CQC are quite behind in the East Midlands region, and particularly in Nottinghamshire. And that's really impactful for us. So although it's good that we've got 73% of our market rated as outstanding or good, we know that 9% haven't received an inspection. 265 providers have not had an inspection for over 2 years, and actually 180 haven't had one for over 37 months, which is quite a lot of time. So that's why it's really important that we keep working closely with CQC. You'll have seen a lot of the national reporting on CQC, and we do work in partnership both nationally and locally, but also really important that we've been reviewing our own risk-based approaches and have bolstered some of our capacity. We call it a provider improvement team, to make sure that when we have got concerns, we have got the capacity to go in and do some quite intensive support, and that has been grant funded at the moment into that support. So where we've seen some of the instability in the market has been in the residential care arena, and also the residential care homes with nursing. And you'll see in this report that over the last year we've supported quite a number very intensively, and that has included teams going in through the night, both contracting teams and also operational teams, really heavy end support. We work with the ICB and NHS partners too, and sometimes we have brought an agency in to support. We have seen 9 closures, and we're able to move people to a safer setting where their support has therefore improved. But we've also worked with 10 settings that have improved, and that has enabled people to stay in their own homes, and that's really important to give that balanced message. More broadly, there's a section on market engagement. We work really closely with our provider partners, and particularly through our Nottinghamshire Care Association, which is really important that we're giving good information about what we need in terms of future shape, what we need more of, less of, etc. We do that through our market position statement. In the last year, we've had 35 engagement events with the market, from themes like strengths-based approach, where our providers have created a good community of practice, sharing good practice about supporting independence and great ideas, right through to really specific areas like housing, and we need more supported living and where we need it, etc. And we meet with developers, etc. We've talked about the Market Sustainability and Improvement Fund that we've had, and that we have passported that to our market. And then we've got a final section which is about our external workforce, which is really important. Our workforce are everything. It's a large workforce, 32,000 people, 81% female, average age 41 and a half, obviously significant contributor to the local economy. But you'll see nationally and locally ongoing recruitment and retention issues, and making sure that we keep this sector attractive to a whole range of people. We want our local people supported by local workforce in their own neighbourhoods where possible, and we want people to enjoy careers in this sector and stay. So we did a big deep dive with the Skills for Care into our workforce, and we're now almost completed in creating our local workforce strategy, and that is also a direct mirror of the national work that's been done between Skills for Care and ADAS in terms of a workforce strategy. 3 priorities that the workforce actually voted for within that include promoting recognition, respect and understanding, recruitment and retention, and development and learning. And two really nice messages that come at the end of that we've managed to achieve recently is we won £100,000 through the RAIN Foundation externally for Nottinghamshire, which is to develop a website to support career development locally, and that's going to be a really good hub to support providers. Really joined up. And we also 2 weeks ago just hosted our first external Proud to Care awards for our external workforce, where we had all of our awards sponsored. We had over 280 nominations, and it was absolutely electric in the room, and a really fantastic first award ceremony. So I hope that's a helpful overview.
Thank you very much. I move the recommendations as detailed in the report. Is there a seconder? Thank you very much. So we're now going to have the floor for debate, and we've got Councillor Carr.
Thank you. It's not good to get reports like this, but it is good, if you know what I mean, because we know what's going off. I find paragraph 6 and 7 quite worrying. It's not our fault. It's the CQC, something else in the country that's broken and needs to be put right. But you've quite rightly pointed out that while those 73% are good or excellent, 27% aren't. And of course, out of all the numbers, there's about 40 to 45 that haven't even been inspected yet, and we don't know. Now, care homes can move in a bad direction very quickly, and I'll give you a brief example. Bramcote Hills Care Home in November 22 was rated as good. By May 2024, it was rated as inadequate. In fact, it got worse. The CQC had to issue an urgent notice to the owners in July 24 for failing to protect people from the risk of harm. And on the 2nd of August 2024, 2 warning notices with regards to consent, safe care treatment, good governance and staffing at Bramcote Hills Care Homes. That's how quickly it can move. So we should really be worried that 9% of our providers haven't even been inspected yet, and we should be worried that the CQC are behind in Nottinghamshire. And my question will be, how can we influence whoever funds or monitors the CQC to actually do something about it? Because, you know, we're in this situation. Governments of all colours have failed to grasp the nettle with regards to social care. Yeah, and in fact, they've not only have they failed to grasp the nettle, but they've allowed it to turn into Japanese knotweed. But there we go.
A question, Councillor Carr, so I'm going to ask Councillor Wheeler to reply in first.
Yeah, Councillor Carr, thanks for the question. So just to give that assurance, a letter's going from myself and Tom today to Sir Julian Hartley, who's the new Chief Executive of CQC, to basically, first of all, welcome him. At the same point, then to outline exactly what you just mentioned there, which is the fact that we are concerned about the fact that how far behind inspection in Nottinghamshire, and that we'd like to work with the CQC to deliver the priorities that needs to do part of the DASH review and to obviously get our inspections increased here in Nottinghamshire. As Katie did mention, our teams do a great job in terms of when we are alerted to an issue, which can be either CQC or concerns obviously raised by the people who are being cared for or their families, and a lot of work does go in, because ultimately, if we can, we want to try and keep people in the home if it's safe to do so, because of course the impact on other people moving them, especially when they're perhaps not being aware they're moving. As Katie's team will know, there's a lot of pushback potentially from residents and carers to move, but if it's not suitable for our people to be in there, they are moved. And yes, there is that financial cost to us, but we absolutely got to make sure that our people are being cared for in the right way. So just give that assurance, Councillor Carr, and obviously if I do get a response back, we're happy to share that with the committee. Thank you.
Thank you, Councillor Wheeler. So we'll move on because we've got a lot to get through. Councillor Owen, would you like to ask your question, please?
Well, it was an observation which was really along similar lines to Councillor Carr. This table on page 52 makes pretty damning reading. There's no doubt in my mind to that. We have one establishment that was rated inadequate and hasn't been inspected for 3 years, and we've 17 that required improvement and haven't been inspected for 3 years, over 3 years. That's unacceptable, and I hope that the letter that the two of you are writing doesn't just ask what they are going to do, that it demands that they take action in terms of inspection. I'd like to ask in particular, you talked about us bolstering capacity. What you mean is doing the job of the CQC, basically, because they're not doing it. And whether it's broken or not comes down to management. You talk about grant funding to assist with that. Where does the grant funding come from? Is it a direct government grant? And does it cover all of our costs? And if it doesn't, then perhaps that letter that's being sent could include some reference to that and a demand that we are fully reimbursed. And just a second question, the executive director was talking about the effects of the budget on uplifting costs and talked in percentage terms. 6%, I think, was the figure that you mentioned. Could you quantify that in terms of real figures? Because a percentage, it can mean anything, it can mean nothing. So could we have an actual figure in pounds, shillings, and pence showing my age?
Melanie.
I believe that Nigel Stevenson put that in the budget report that went to cabinet. So I don't have it to hand, but I believe that was because you presented the numbers, didn't you, Councillor?
Yeah,
so I believe that number was in the budget report. So we can just double check that. And yes, it's about $750,000 we're paying for the PIT team that Kate has referred to, the Provider Improvement Team. That's from the Market Sustainability Grant. So that's a grant that we get. It's a temporary money. It's a temporary grant from the Department of Health and Social Care to sustain the adult social care market. It's not the best way to invest, in my opinion, because that's about responding to crisis. It's not helping us grow the workforce, develop, and all the things we'd like to do in the workforce strategy. But you're quite right, it's about the need to do that because of the gap. And it means that Table 7 is quite meaningless because the inspections are so behind, we don't actually know the state of the quality of the market in Nottinghamshire, which is a big risk for us, I think, as a council.
Thank you, Ms Williams. Councillor Henshaw.
Thanks, Chair. I'm quite interested in the points that have been raised in relation to the CQC as someone that's been in and around CQ inspections for many years. But I wonder if there would be any mileage in us as a scrutiny committee asking the people from the CQC to come here and talk to us in relation to the problems that they're facing, why they can't get around their inspections, and just generally discuss the issue with us as a scrutiny committee, because it's all right the portfolio holders sending letters off. We're the people that's actually scrutinising a report that's before us, and one of the issues has been raised by a lot of members that they're concerned, and I think we should do that at some point. And I know time's running out in relation to that, but I still think it's something we should consider. When you're looking at has been mentioned in relation to the budget, there may well be problems further down the line, and Melanie's quite rightly said there's some detail to come, and the devil is always in the detail. But if recruitment and retention has been an ongoing problem in relation to care staff for many years, and it's something that we scratch the surface of, and I know wages and conditions aren't the only issue when it comes to people offering themselves to work in care, but certainly if you increase the wages of people, that is an added bonus. And I've been speaking to people that are quite highly delighted. People on the shop floor are highly delighted that they've got the highest increase in the national living wage for many years, and it may help a number of them to remain in care as opposed to going off and working in Aldi or working for Amazon. And I know it's not the only issue, and it's quite right, it's been pointed out that we've got to have a workforce strategy in relation to the way in which people can progress in care, and I await the further reports on how we can best develop and enhance the staff that we've already got to stop them going through the door. The other issue I've got is, or a question I want. Well, you can do, but if this is the last one, Chair. It's in relation to recruitment and retention of overseas staff, because I'm quite interested in I think nationally the numbers of people coming into care from overseas is reducing, but I'm interested to know how that is in Nottinghamshire, if we have any figures. Thanks, Chair.
Councillor Wheeler to respond.
Yeah, thanks, Chair. I'll first, then I'll hand over to Kate. That's okay. So, just on the point, Councillor, you raised there, £31 million is the bill we actually is the total cost expecting from external care providers as the result of the budget as it stands, until we find out exactly who will be compensated. As if there's further details, so it is a huge, obviously, bill that can come the way, and that we'd have to obviously meet as part of the ongoing pressure as well. So, in terms of from Councillor Henshaw, we talked about our staff. You know, I've been going for a longer time. We're going across the whole county, speaking to many of our teams, and the key thing they've actually raised to me, wages was raised, but the making was about actually the job itself. I wanted to actually be caring for people, the more hours spent, because there were a lot of people saying I spend more of my time writing reports than I do actually caring. One person said, because I wish I'd done an accountancy course because I didn't realise I go into care because of the amount of work needed. So that's why we have a lot of work in terms of the AI that we're introducing, in terms of what can be done for some of the initial reports, for obviously looked over by social care workers, in case we talk about more, and the brokerage scheme. So actually we've got people who can actually do that work to the care packages, so our people can actually spend more time caring, which is what they got the profession for. And on the point about wages, I absolutely welcome our staff being paid more. So my point is to make sure it's fully funded, because otherwise if it's coming from something else, well, paying our people, if I haven't got the money to still pay to hire them in the first place or actually elsewhere, then it's defeating the overall purpose. So very much welcome, like I say, that money. Just hope that we do get that clarity from the Chancellor and the Secretary of State to how that will be funded, and to make sure that we can do quality services. But if it's okay, I'll hand over to Katie about the final point you made really around the recruitment about the overseas team.
Councillor, Katie.
Thank you. Yes, we've got some figures for you in the report in paragraph 27. So we've got 17% non-EU and 4% EU in terms of internationally recruited workforce, which has been really important for us.
Yeah, right. We're happy with that. So we'll move on to Councillor Martin.
Yeah, it's just a question really. Who sets the rate by which we pay the care homes for the fully funded residents?
Yeah, we do. So I was saying, Cabinet in February, I'll present that report in terms of fees. So obviously, that's why there is that potential budget pressure onto us increase, because of course, currently the care association are pointed out that unless they are fully compensated, they're going to be asking for a much higher increase to cover their costs. That's something that we'd have to meet if that's not funded by the government, which obviously puts extra pressure on our budget situation.
Ms. Williams.
Just to add, the way that we do that, we have a cost of care exercise, which then forms the recommendations the Cabinet makes to Cabinet. So we take into account the changing needs of the providers, the cost of providing care, pressures that they're facing, but also the sorts of care that we want to incentivise. So we use our market position statement and our market's sustainability plans to help us, because we know that we don't have even supply around the county, and we know that costs vary between different places. So we kind of use as much intelligence as possible and the available resources that we have, which is key.
Much, Ms. Williams. So that ends the questions. I'm going to ask Martin to read out any areas for the consideration that have arisen from your discussion. Martin, go ahead.
Yeah. So obviously there's been quite a discussion about the role of the CQC. So I think if you agree that the chair has a discussion with officers about how it might be possible to involve the CQC directly in some scrutiny work. And then I think also it would probably be useful if that letter that the Cabinet member is sending to the CQC, if that is circulated to members, just so they can see what that letter actually details.
The recommendations have been moved and seconded, and we now take a vote on a show of hands. All those in favour, please. Thank you very much, everybody. Move on to item 6. Now, this is adult social care performance, risks and financial position, and it's for the quarter 2, 2024-25. I'm going to ask Councillor Wheeler, Cabinet Member for Adult Social Care, to introduce the report.
Yeah, thank you, Chairman. It's just a brief introduction, and obviously hand over to Mel and takes a question afterwards. But I just want to say really pleased to actually be able to present this report today. So it shows our progress in the priorities set out in the local account and our latest financial performance and department risks. So, like I say, once Mel's taken through it, I'm happy to answer the committee's questions. Thank you.
So I'm not going to read the report to you, but I'm going to talk through some of the things that are really important and I'd like you to have a look at. I think firstly, the progress we're making on people waiting for support. So you've heard me talk for the last 2 years about our biggest risk is people waiting for something to happen. So that may be waiting for their care to change, it may be waiting for an assessment, it may be waiting for safeguarding to conclude. So that's been a big concern of us and a real focus of the operational teams. So those waiting times are continuing to improve, but in my view still at a rate that's much higher than we would want and that people would are statutorily entitled to under the Care Act. But nonetheless, it is an improving picture. We've also talked many times about housing options and the importance of people having a home, their own front door, in a place that's adapted to meet their needs, and that it is in a good state of repair, and that is warm and it generates good health. So we touch on the corporate strategy. So really pleased that Cabinet considered the housing policy. So in adult social care, what I can't control is the amount of development that happens in the county for supported accommodation, or the amount of general needs housing that's available, or the quality of private landlords. They're tasks that are outside of my control. But so through the corporate housing strategy, what we're trying to do is to generate cross-working with all our housing authorities through the 7 district and borough councils, and working alongside public health and children's colleagues, try and build homes that are fit for life and have enough supply. So we're really pleased that work is starting, but it's starting. We've got quite a long way to go before we can meet the needs of people. We think we've probably got about 700 people that could be in a less restricted form of accommodation if we had the right form of accommodations. That work is really important. On page 8, we talk about our work on digitally enabling lives, and that remains really key because we know that people are telling us that they expect the same level of digital access in their lives that we all have. So a lot of us run our lives through our laptops and smartphones, and we've got a way to go to enable that for people, and we draw upon care and support. And we've got a case study at the top of page 62 that talks about the wearable technology we've been piloting with Lily. So that's just a case example to draw your attention to there. We know from our big conversations, so if you remember, people from Our Voice, that's our co-production group, came to present the local account earlier this year to you, and it was a great moment because people presented it themselves. It wasn't me filtering what they thought, and we were talking about how we had produced the local account, which is how we report against performance here, and how it was drawn upon the targets that I have to deliver from the council, the targets I have to deliver from government. And what's really important is people's views, their own lived experience of what works and what doesn't work. And one of the things that we've heard consistently is about the quality of our information, advice and guidance. And that's not just about adult social care, it's about how we work with the customer services centre, how accessible our website is, and how we work with our partnership across the council. Because people, there's a term earlier about how do people know about safeguarding. We rely on a system of people actually out there to be informing people about their adult social care entitlements. So we've got some examples there about the work we're doing to improve that. It's been really important about information on finance and benefits. Adult social care is not free. You have a process to pay for your care. You're financially assessed, and we know that's a big cause of tension. It's the same for all of us. When we build, we get quite irritated, don't we, about having to pay anything. It's not very nice. But secondly, if the information's not clear, we don't understand it and it's not timely. So that's really important. So we're working really hard to improve that, and improve not just the way client financial services work, but how debt management in the council works too, to recover money owed to the council. I think I'd like to draw your attention as well to that story on page 64 about building confidence to travel independently. So you'll be aware that transport is quite a challenge across the county. So we've got big areas of rurality, and it's very difficult to get from A to B if you don't drive often. So transport's really crucial to us, and particularly enabling people to be active and participating, out there and enjoying their, where the place where they live. So that's really important about how we support people to access what transport we do have and make the best use of it. So just to draw your attention to that. I want to highlight the performance, which fortunately in the pages is black and white, so you can't see it as a glaring red, but nonetheless is red for reviews on page 65. And just to do a little bit of reminder here, so when we compare ourselves to the best performing county councils and to East Midlands, we're one of the highest performers for undertaking reviews. So we've got a good performance when you compare to others. But everybody under the Care Act's entitled to review, so therefore our performance is 100%. But it's very difficult to close that gap because people pass on or they've moved around. There's some good reasons why we don't include it, but nonetheless we should be really up there in the 90s for undertaking reviews. It underpins everything else that happens in adult social care. So I'm just going to be upfront really and talk about why the indicator's red. But like I say, nonetheless, when we compare ourselves to comparators, we perform really well. I think the last thing I wanted to touch upon is about supporting people in crisis and some of the indicators where we know we've got some good performance there. We know that it's still not enough, the work that we do, and that we have a lot of requests for urgent support, particularly on a Friday afternoon. And Katie's described some of the home closures that we have. So there's still some more to do, particularly around working in partnership with acute mental health and supporting mental health crisis in terms of prevention and then hospital discharge. And Ainsley talked about that, I think 2 committees ago, wasn't Ainsley, some of the work there. So more to do, but nonetheless some really good performance on physical acute hospital discharge and reablement numbers there on page 66. And I think we've covered off the risks that we mentioned at the end of the page as we've been talking in conversation. So there's nothing I don't think we've covered. We've talked about care quality and data. You heard about data when we talked about the Safeguarding Adults Board. So I think, Chair, that's probably the highlights from that report.
So I'm going to move the recommendations as detailed in this report, and I seek a seconder. Thank you very much. I've got a seconder. I'm now going to open the floor for debate. Any questions? Questions seem a bit scarce on this particular item. Yes, go ahead, Councillor Martin.
So I'm so I'm to take it from this final page that you're waiting for the government to respond from the autumn statement before any impact is seen on the reduction of income, etc.
Referring to the,
on the
some of
page 69 and 68, you've got two there that no change on.
The report was done early, Councillor Wheeler, which I'm quite happy about, and that's why Mel made her announcement. So that's where you're talking from. Yeah.
We are still waiting to find out more about the decisions in terms of the pushback on charging reform. So I know the minister's supposed to be meeting, I think yesterday, or in terms of what they're going to be doing to fund social care going forward. So it's frustration for me because the announcements were pushed back in terms of the charging reform. We had a lot to talk about the NHS. We know if social care is funded correctly, they can actually have a huge impact on saving money for the NHS. If we are looking after people and keeping them out of hospitals, the effect on the economy and obviously for that person as well is a lot better. And so that's why I think social care needs to be said in the same breath as the NHS. We talk about 22 billion for the NHS, but it's then pennies given to adult social care. So once we get that clarification from government, we really welcome, because we need to be able to obviously set our budgets correctly going forward, but also to recognise that we've got a aging population. We've got declining birth rate, so it's only going to go one way in terms of the needs for social care. So it needs to be addressed, and the items put in place quite quickly to make sure that we can look after our people, and there's not an even bigger financial burden down the lines that we'll all be paying.
Have been moved and seconded, and take a vote in the show of hands. All those in favour, please. Thank you very much. So we move on to item 7, public health performance, risks and financial position, Q2 2024-25. And ask Councillor Scott Carlton, Cabinet Member for Communities and Public Health, to introduce this report.
Thank you, Chairman. Good morning, colleagues. This report summarises the key performance, risk and financial position for public health. The reporting governance of public health remains under review, given the move of public health to the Place Department. In Q2, performance of the Public Health Commission services continues to be strong, with delivery of the majority of the key performance indicators, although some expected seasonal variation is seen. There are a number of improvements in performance for a number of the services. For example, the rates of NHS health checks invites of the eligible population increased to 69.52% from 61.04%. The Healthy Family Programme continues to deliver for Nottinghamshire's families, with 91% of newborns, which is in real numbers 1,550 newborns, receiving a 10 to 14-day health visit and review within the 14 days of birth. This rose to 99% by the end of the quarter, usually by day 18, and 100% of those were completed as face-to-face contacts. 6 to 8 week review performance reduced slightly in Q2, but was still just under 97% by the end of the quarter, again as all face-to-face contacts. Following helpful discussion at this meeting in September, Cabinet have now approved the carrying out of a competitive tender process and subsequent award of contract for delivery of the single integrated service to deliver the Nottinghamshire Healthy Families Programme for a period of up to 5 years from October 2025. There are again some excellent stories of difference within the report, which highlight the impact that our public health services are continuing to make for Nottinghamshire's residents, and if you've not read them already, I would urge members to do so. This report includes the annual deep dive of the Public Health Outcomes Framework, POF for short. The majority of the indicators within POF that can be compared show Nottinghamshire as better than or similar to the England average in the latest data, with areas for improvement highlighted. Performance against the annual delivery plan is either complete or on track for priorities led by the Public Health Division. This includes successfully organising the Nottinghamshire Food Summit on World Food Day on the 16th of October to co-design the priorities and actions with the Nottinghamshire Food Plan. Period 6 budget monitoring for financial year 24-25 indicates that the public health ring-fence budget is currently underspent by £420,000, which is 0.09% of the overall budget. A detailed plan to spend the existing public health reserves was approved by Cabinet in July of this year and starting to be implemented. Our workforce position for the public health team, not including commission services, continues to be strong, with turnover and sickness absence rates low. There have been no significant changes to the risk register, with no risks from public health currently rated as very high. Chairman, your recommendations are set out on pages 73 and 74, and at this point I'm just going to pause and hand over to the Interim Director of Public Health to briefly take us through the report.
Thank you, Chair. Martin, did we want to share the slides that are in Appendix A? If you may, that would be really helpful, please. So these are just the slides that you will have seen in your agenda pack under Appendix A. But I just thought just to have a bit of visuals, we're going through it, if I may. So I'll crack on while Martin's working on that one, so thank you for that. So as you will have seen, first of all, the first 3 slides talk about some real stories of difference, and really keen to demonstrate here some of the key themes that have come through the meeting this morning around really supporting individuals with severe multiple disadvantage. So there's a case study around homelessness, one around substance use, and one around domestic abuse. Really demonstrating here how within those services it's the importance around the flexibility around wrapping that service around the individual. So you'll see within those case studies how the services have moved and flexed to really meet those individual needs, whether it's supporting people through court proceedings because they were concerned around losing their house, whether it's support around accessing the benefits and support that they can to maintain in accommodation, but also some really positive examples around how working with that service has really improved their confidence, health and well-being, and overall mental health well-being to support them into employment as well. So really showing how they are supporting those building blocks of good health, so those good housing, good work, good communities, and good having that baseline building blocks to enable that individual to have an overall positive health and well-being. So if we move then on to the statutory duties, first of all, we're talking around sexual health. Performance maintains really positive in this service, and at the end of this quarter, they were just looking around transitioning into the new service, which has started on the 1st of October. I will make sure that in the next report we do a bit more of a deep dive on that, but what we're seeing so far is a really positive transition into the new service. The next area touches on health checks, and Councillor Carlton has already mentioned the improvement in invites around health checks. But I think one of the things that I was really keen to highlight from this slide is how what we're really looking for with health checks is that conversion into identifying individuals who are at higher risk of cardiovascular disease or diabetes or dementia is also covered in that health check. So, and we're actually seeing quite small proportions of those, and that's something that you see nationally, but we are working on that locally around how we can improve that uptake, but also how we can make sure that we're having that more equitable access across the whole of Nottinghamshire, because we can see some really good areas of good practice in the Basset Law practices, and how can we roll that out overall. Moving on to the next slide, we talk around the prescribed children's 0 to 5 services and those mandated contacts that we know are really important to ensure a best start for life that are delivered through our Healthy Families programme. Scott's mentioned the strong performance on that already, and just wanted to highlight we are aware that there have been a slight dip in a couple of indicators for quarter 2, but this is something we see quite regularly because the quarter covers around holiday period, so many parents and things are often choosing actively that that appointment's not quite right for them because they're on holiday or they're doing other things with their families, but just to provide that reassurance that the newborn reviews and the 6 to 8 week reviews, 100% of those were delivered face to face, and by the end of the quarter 99 and 97% of parents received those reviews on time, and every child is accounted for. So just to give that absolute assurance that we're still really maintaining that strong performance, we've got really good quality management reviews in that, and there will be a quality review in December to bolster some of that work. Next slide, please. So integrated wellbeing service, that service continues to meet our key performance indicators. This is another service which does have that slight dip in demand over the summer, but we tend to see a bit of a rise after Christmas as people are deciding whether they want to do any New Year's resolutions. So that service is performing well and on track. And then the next slide is around some of our other services around that severe multiple disadvantage cohort. And one area that I would like to highlight is we have seen a slight dip in performance in one of our homelessness services, and this was due to the number of people who were evicted from the hostel is slightly higher than we've seen in previous quarters. But what I wanted to highlight here was that these are very small numbers of individuals. So if you get slight movements, then it creates quite a big difference when it comes to the performance of the indicator. But what I was really reassured around was the reason behind some of these evictions was to make sure that it was safe for all residents who were accessing those services, and any situations were dealt with really swiftly and quickly. So to provide that reassurance there. But I think it does pick up on some of the points that Mel was highlighting earlier in terms of really needing that throughput and flow through around our housing overall, because we know some of our service users we would like to be able to move more quickly, but it is about making sure there is the right accommodation for them to move on to it, and that can sometimes be a bit more of a system issue that we're looking into. The other area just to highlight in here is around some of the domestic abuse work. So we know this is a service that continues to be under quite a lot of pressure in terms of demand and complexity of cases, and we are working with that provider to really understand what that means for them. Next one, please. One of the things, apologies, in the last slide as well, one of the good news stories around our substance use service is around OHID are really keen to work with them around some collaborative work around working with people who use opiates, because it has a really good strong track record around working with people with substance use. So a good news story there. This is our annual delivery plan progress, which is a slightly new addition to the report. No key messages here is that we're all on track in terms of our support to some of those broader ambitions towards the Nottinghamshire plan. And then this is the deep dive, I suppose, into the public health outcomes framework. So this is a report that you would have seen separately in previous years, but we thought we would bring it together because what we're really trying to do is develop that sort of golden thread between what our services are delivering, or the outputs that you're seeing, and what impacts that's having on and outcomes on the longer term for our residents and people in Nottinghamshire. And what we can see here, and there is a very detailed appendix in the report for those that would like to get into the detail of that. But I'm just highlighting some key highlights on this slide. And one thing that I would say is around the caveat around the data. So because this is outcomes data, sometimes the timescales of the data is a little bit later, and each indicator has a slightly different timescale. So just to bear that in mind. But some of the overarching indicators that we can see is we've still got work to do around particularly our females in Nottinghamshire, who we know have lower life expectancy, healthy life expectancy, and disability life expectancy than the England average. So we know that there's lots of work to do. Now, we are doing a joint strategic needs assessment specifically on understanding what's going on in that particular area with our women, and how can we support them to really increase their opportunities in terms of length and quality of life. For our males, when we compare their life expectancy and healthy life expectancy, once they're aged 65, they also have lower life expectancy than England. So what we're seeing here is some of the further work that we're really keen to do around reducing our health inequalities across Nottinghamshire. So we know, for example, that if you are a woman living in the most deprived areas of Nottinghamshire, your life is cut short by about 7.7 years. If you are a male, that's 9.3 years. So there's still lots of work for us to do in Nottinghamshire around how can we create that more balanced playing field so that everybody has the best opportunity to have the best length and quality of life in Nottinghamshire. In terms of some of the other indicators, there's been some positive areas around school readiness and in a couple of different areas, but some other areas that we're really keen to think around are around some of our more vulnerable populations, particularly those with learning disabilities or severe multiple illness, and some of the work to support some of our carers. There's also some work around Best Start for Life, particularly thinking around some of our indicators in pregnancy, and also thinking around our obesity indicator for adults. But there is some really good work going on in Nottinghamshire as well, and I think one of the things that I'm really keen to highlight here is, although we've highlighted some of the key areas that we might want to concentrate on there, actually overall Nottinghamshire is either better than or similar than the England average. So just a few areas there, Chair, for you to highlight in terms of whether there might be some areas that the committee might be more interested in to do a bit more deep dive in the future. And then I think the last slide is just about budget, which we've already touched on. So I think that's all that I wanted to cover, Chair. Thank you.
For giving that report and those highlights, Ms Robbins. I now move the recommendations as detailed in the report. We've got a seconder, my advice, and I'm now going to open the floor for debate.
Yes, thank you very much, and thank you very much for your hard work in trying to improve my life expectancy. I know 9 years is quite a lot for somebody my age, and I'm hoping that I will look after myself and help improve your numbers. I do have a question on the final page, page 85. The numbers. I don't know whether maybe I am aged or whatever, but for me, if you've got a latest forecast variance of £420,000. And the budget is £4,525,000, 4.5 million. That's about 10% to me, or 9%, not 0.9% in the narrative below. 420 is about a tenth of 4,522. Is that right?
Right. Sorry, apologies. That does look not quite right. I will go back and double check with finance colleagues. One of the things that I would say around
the budget underspending. My apologies for any inaccuracies in the paper. Is that one of the things that we are aware of is that we have a number of pay awards. So as have been mentioned earlier, so there may be some changes in that because we might have to consider around how we are supporting pay awards moving forward, which I think will bring us more. We probably have a smaller underspend moving forward.
Okay, it was just that accuracy of the percentage quoted there.
Apologies.
Thank you.
Absolutely, I can confirm what the latest position is. Thank you.
So we've got Councillor Henshaw next.
Thanks for the report. It's very interesting, and it sort of touches on what we discussed at Health Scrutiny last week. A few of the topics in relation to vaccinations and obesity and things. It's all very interesting. I take note from the report in relation to the points on sexual health, and I know some areas are moving towards letting people to contact yourselves in relation to doing it online. I just wonder if there's any move in relation to that sort of approach from us. You may well have said at some point and I've missed it, but I'd be interested to know about that. And also touching on, because I think it's in the report, on the vaccination issue, about it making sure that people are aware that vaccination is a good thing and we should be encouraging it. If you touch on that, but I mean, there are a lot of good things in this report, but I just wonder if there anything that you're not too happy with that you'd like to impart to us as a committee so that we can support you. Thanks, Chair.
Councillor Henshaw, go ahead, Viv.
Thank you for your questions, Councillor. So, in terms of our sexual health service, one of the key developments in the new integrated sexual health service, which is an integrated service with the city as well, because we know that our residents flow in and out of the city, is a really strong online offer. So we had an online offer before, but the new service really builds on that. So if I may, what I'll make sure is in the next report, we're going to do a bit of a deep dive on that one anyway to give you the assurance. But what I can do is specifically make sure that you're really clear on the level of online services that we deliver, because it's one thing that we've got something at the moment, but we're keen to keep moving on it, because we know that actually the proportion of particularly young adults that prefer going and using the service online continues to increase, particularly since we've moved through COVID. So actually we're seeing that the sort of university age individuals, that's a really popular offer. So we will continue to do that on that. In terms of vaccinations, you're absolutely right. Vaccinations are absolutely critical in terms of supporting and protecting our population, and something that I would absolutely advocate for as much as possible. We know that we do fairly well for dose 1 of vaccinations in childhood, but it's dose 2 that we don't do as well on. So when we compare ourselves nationally, we're doing okay, we're probably fairly similar, but actually we know that vaccination rates overall are declining. And what we're aiming for is that sort of 95% ideally, because then we get herd immunity. So those individuals that can't have the vaccine are protected because the whole of the population is pretty much protected. So I'd be really keen to do more work around dose 2, those dose 2s, and some vaccinations around HPV. But also we find for flu and COVID, we do generally quite well in the overall cohort, but it's our at-risk cohort. So it's the under 65s that have underlying health conditions, that those tend to be people that we know are really at high risk of the implications of COVID and flu, but also we don't have as high uptake. So any support that we could do around that, particularly in this winter period, would be really grateful for. But I think the overall piece of work that I think is going to be really helpful once we've got the information around is really understanding what's working, what's happening around our female healthy life expectancy and life expectancy. And a lot of the work that the team are doing, and Ian's come in from the analytical team to support today, is really understanding what we can do locally to understand the data better. So when we get that report, more than happy to share that if that would be helpful, because that's something that we're certainly going to be doing a bit more of a deep dive on, because we know the trends are not going in the direction that we would like to. Thank you, Chair.
Very much. So if you're happy with that, we'll move on. Councillor Pringle.
Thanks, Chair. Thanks, Viv. once again, detailed reports. Thanks, Scott, as well. Pleased to see the reference to the mental illness and the work going on there, and the focus case study, Nottinghamshire and the Mess in Middleton Lodge and its smoking efforts to reduce smoking, not its smoking, to reduce its smoking. But being obviously, Chair, you can see, you don't need me to tell you, I'm the pinnacle of fitness, and obviously not obesity. However, as the colleagues mentioned, being told that I've got a mirror, all right, Councillor Carr, we die 9 years younger than those in more affluent areas. I'm still, as colleagues, hanging on there to regain. 90 is my target. I don't know if he was looking at me quizzical. Well, that's still what I'm going for, with. But we've had, I read a report. We talked about weight management, and I read a report. I think it was about 260 billion cost to us nationally with regard to obesity. Is there any change from the new government in seeing any improvements in that, or more support in that coming down? Thank you, Chair.
Viv, or you?
Yeah,
sorry, Councillor Carl.
No, absolutely fine, Chairman. I was going to say, I'll pick up on one point around Councillor Pringle's comments, and then I'll hand over to Viv. That's just obviously on the ongoing support around the mental health and suicide prevention agenda, which I'm eternally grateful to all members from across the chamber. So you'll be aware that recently I approved the suicide prevention strategy within the recommendations after we'd met informally. I had agreed that there would be future update reports on performance coming to a future select committee once that position is clarified. In terms of that sort of reporting mechanism, if you like, where we're coming currently to select committee here, that nothing will change this side of the lifetime of this council, but we'd look to conclude that into the lifetime of the next. On the other points, I'm going to hand over to Viv.
Thank you, and thank you, Councillor, for raising the really important issue around obesity, because we know that following tobacco, obesity is one of the biggest causes of premature mortality, so a cause of people dying earlier than they need to, because it has such an impact on some of the major killers in terms of cardiovascular disease, cancers, and those sort of diseases. So thank you for that. In terms of what we're doing from a public health point of view, we have the integrated wellbeing service, which delivers a weight management programme to the whole of the county now. They're looking at further ways that they can support particular population groups. So you'll see in the report they're doing specific work around people with serious mental illness, and we have specific indicators within the contract to make them target, I think it's the 40% most deprived areas within the county, because we know that's aligned to where there are greater levels of obesity. But I think one of the things that we do need to highlight with obesity is it's a really complex agenda, and there are so many things that impacts on somebody's weight. Now, it could be nutrition, it could be physical activity, but it is also really impacted on the environment that they live. So if they want to, we know that there are communities in Nottinghamshire that are really keen to do more physical activity, but they may not feel that they are in a position to go out and go for a walk or a run after dark, for example. Or it may be that we know that they would like to eat more fruit and veg, but actually within their communities that's really difficult to get hold of, or they're having to decide whether they have what they eat versus whether they keep their house warm. And we know that some of our more processed foods tend to be cheaper. So there's lots of work that we're doing around working in our communities around increasing access to good sustainable food, and the work that Dawn and the team have done around the Food Summit, and looking at our food strategies is supporting some of that. But there's a lot more that we can do around our environment, and I think that links back to some of the comments I was talking around in terms of really having good, strong building blocks in place, because all of these things are very interconnected. So it's certainly an area that we're going to be looking at what we can do further. In the future, it's always going to be a really important priority for public health, but it's one that that is very complex. So I wouldn't anticipate that you're going to see changes very, very quickly. But be assured that we're doing a lot of work also with the Healthy Families programme around the National Childhood Measurement Programme, where we weigh our children in reception in year 6, and what are we doing to really encourage those really positive behaviours at a very young age that can also have impacts onto the broader family as well. Thank you.
Thank you, Ms Robbins. So I've got no more questions and we must move on. So I'm going to ask Martin to read out any areas for further consideration that have arisen from your discussions.
So it's 3 things. So I think we'll get some clarification on those budget figures and we'll get that recirculated to the committee. Secondly, that the next report includes the deep dive on the sexual health service, and then that the report on female healthy life expectancy is shared with committee members as soon as it's available.
Moved and seconded, and we now take the vote in a show of hands. All those in favour? Thank you. Item 8. Development of the prevention approach and offer in adult social care. Councillor Jonathan Wheeler, Cabinet Member for Adult Social Care, will introduce the report.
Yeah, thank you, Chairman. So colleagues will know how important prevention and early intervention is to keep people as healthy as possible for as long as possible. We're therefore producing a new framework so we can focus on delivering the best possible outcomes, and obviously I welcome the committee's feedback on the work being undertaken. So I'll answer the question at the end, but I'll hand over to Katie, if that's okay, Chairman, for the substantial report.
Thank you. Thank you for the opportunity to talk about this. So I think to cover a number of things in here is we have a Care Act duty to make sure that we prevent, reduce, delay people's need for higher levels of support. That's all about our strategic direction of making sure people stay independent and as well as they can for as long as they can. And so this report does talk to the fact that we absolutely broadly meet that statutory duty. However, two things that are quite useful. There are some really positive stories, 2 positive stories cited in this particular report, but you'll have seen lots of positive stories that have involved preventative support that have come through lots of the themes that we've brought here before. So that we know that we support thousands of people to live their gloriously ordinary lives in a well and independent way each year. But we also know from lots of the reports that we bring through and lots of the events that we've held with people from our communities, with partners and our workforce, that we do see lots of people in more restricted settings than they need to be, or having outcomes that they didn't need to get to, reaching crisis when perhaps that could have been prevented. So for that reason, and also the reason in the first paragraph about the national picture, where we've seen over the last 15 years or so a whole range of contributors to why lots of the money in health and care systems has been drawn up to the acute end rather than the preventative end. We really want to think differently now and take a much more deliberate approach in a strategic way about approaching prevention and making it impact. So what we've done is we've started a commissioning process, which is to look at what does good practice look like, what does the evidence look like, what are other places doing, what does our local prevention support look like, and how do we develop a framework that can help us to make our preventative work impact even further. So what this outlines for you, we're partway through that process. We have looked at the evidence nationally, and this has been really interesting in that when we talk about the pure health arena, the public health arena and the children's arena, there's lots and lots of very strong evidence and evidence base about prevention, support and approaches and what works. In the adult social care arena, nationally as well as locally, just the same amount has not been evaluated. And that's a really, really important message for us. So there's a lot of conversation nationally now about how we get better at evaluating a lot of the preventative support that we have. And we want to be really deliberate about that locally as well. Secondly, just to bring to your attention, we undertook a JSNA, a Joint Strategic Needs Assessment on adult social care prevention and equity, and that went through Health and Wellbeing Board earlier this year in July. We think that we might have been the first place in the country to do a JSNA in that way, which is a really good ambition for Nottinghamshire. And that was a really good starting point for us, and it picked up lots of interesting perspectives and points for us that we've been able to then build on. And that's actually some of the mapping that was undertaken as part of the JSNA is included in the appendix, but we need to build on that. So what we've then started to do is a whole range of mapping of, we know lots of the ways that we work and our strengths-based approach is about being preventative, but what about our services and support that we have that is commissioned or that we partner our voluntary community sector on, etc. What counts as prevention? Because it's not always that clear. Support can work right from supporting people just on the edge of potentially needing care and support, right through to the edge of crisis. And some of our support meets all of those levels. So we're doing that mapping at the moment. The 37 million that's quoted is a point in time, and that includes our home care services because they help people to stay at home, and some of the people that may have gone on to be in residential care, we've shown that with technology and home care support you can stay in your own home, which is what most people want, for example. So home care is a massive part of that 37 million last year. And then that includes some of our commissioned services, but that and I think we can send an updated version, because I apologise, the 37 million and the mapping in the JSNA don't quite go together. So we've got an updated list that we can circulate, but actually it will change a little bit more right up to probably the end of December as we're doing this work. And what we'll build into that is some of the mapping that's been happening in the police department with the voluntary and community sector. Also joint funded preventative support, like our integrated community and equipment loan service, for example, and some of our directly provided services that we run in-house, like our reablement service, etc. So we are it's a live piece that is moving forwards quite quickly. And apologies, one of the services that is mentioned in Ashfield, the Open Door, is cited as Age UK, and we've got the provider wrong, so we'll update that when we circulate that, apologies. But the mapping is really helping us to raise some useful questions. So what we've also started to do is look at best practice elsewhere, how we can maximise some of our prevention work through our strategies. So we've got our tech-enabled care strategy, carers strategy, housing strategy, etc. How can we really push the preventative end through those things? And what we're now doing, as Councillor Wheeler has just suggested, is to design a high-level proactive prevention framework. So Viv's talked about the building blocks of prevention and good health. We are talking about the jigsaw piece that comes a little bit further along, which is a proactive prevention. So what activity we can do to turn that dial that has an immediate impact up to about 3 years. So people that are on the edge of potentially needing adult social care support, right through to being on the edge of a crisis, and how we can support people to back away from that crisis. We want to put lots of test and learn around that work and build our evidence, but this document gives you a shape to what we're trying to do. So you've got principles in there, and we are developing recommendations at 6 levels, from policy and strategy through to research, workforce, place-based approaches, our services and our pathways, because there are lots of opportunities in there. And what we want to get to is a delivery model where we then move from this high-level framework into a year 1 action plan that we can co-produce with people, and some of those pieces where we might change some of the way that our services run or bolster some of the things that we've got. We need to co-produce how we do that with people. But also we're involved in 2 national groups, which is really great for Nottinghamshire. So firstly, there's a national group with 3 think tanks and 12 local authorities looking at proactive prevention with older people, and we are in that national group looking at selecting a cohort of people where we all do a delivery trial in terms of using the same type of intervention or support, and that will create on a mass level evidence around how well that is working, which I think is a really great opportunity for us in Nottinghamshire as well as nationally for adult social care. And also we've been working with the County Council Network and Newton, who have used some of our data and data from a whole range of local authorities to look at what is changing for working age adults with a lifelong disability. And the next phase of that work is going to be looking at some of the models of preventative support that work best. So this is a really live piece. It's about helping us take prevention to the next level, turn the volume up across everything that we've got, evaluate better some of the things that we've got so that we can make even better decisions about best value and our funding. So I hope that's a helpful overview.
Thank you, Katie. I move the recommendations as detailed in the report. I have a second of the Vice Chair. Thank you. I'm now going to ask Councillor Carr to ask his question.
Thank you, Chairman. I think this is one of these cases where we've got a report that tells us a lot, but there's very little opportunity there to scrutinise what's been happening. I'm just wondering where the input from councils is going to be with this new framework, and whether perhaps we could have had a working party on this, but that's another matter. I'm going to be a bit of a critical friend here. Paragraph 11 tells us at the end, however, there are also too many people in crisis or receiving more restrictive support, and some difficult stories across the health and care system where preventative opportunities have been missed. That's then followed by some good local positive stories. Where's the non-positive stories? How, as councillors, can we scrutinise that and what's been happening and what we could be doing to put it right if we're not told what the bad is as well as the good? So I would like to have seen a lot more information in this report about everything, warts and all, so that we can actually get to the root problems of it as councillors. I know you're doing it as officers, but councillors need to be involved as well. Thank you.
Katie.
Thank you. I completely accept that feedback, and we would be really supportive of anyone that wants to work with us. I think there's going to be a lot of work. This is about that first pulling together of a framework about where we should focus our the work, but I think January to March will be about developing a year one action plan, and we'd be really welcoming of further scrutiny and support into that. In terms of some of the stories of what's working well and what's not, our JSNA covers lots and lots of detail and information, and I didn't want to repeat some of that in there, so hopefully that is helpful. But also I have referred to, there are lots of workshops that happen. For example, a joint workshop on our new mental health support pathway across the health and care system was held, which involved the workforce, it involved lots of people, and we did hear lots of stories and lots of themes from people at that event and many events. So for example, somebody that had ended up in mental health inpatient support that was suggesting actually if there had been more re-ablement and support for mental health at the point of her feeling in crisis, that would have really helped. And I think what we're seeing is across all of our pathways there's some good support, but people need a little bit more at that crisis point. So I could have a think about perhaps how we draw some of that together better and those themes and how we bring that through. I think we were trying not to repeat perhaps such a mass of things that have been through, but yes, I understand what you're suggesting.
Thank you very much for that. Councillor Moxon.
Yeah, thank you, Chair. Just looking through the report, and I just had to have a quick look at it again and do a search throughout the whole report. There's not a single mention in there about COVID, which I find really surprising. Certainly the word COVID doesn't appear anywhere in the report or in the appendix. and it sort of suggested that it never happened and it didn't have any effect on any of these issues at all. I'm a bit concerned that we've missed probably the biggest thing that's happened in this country since the Second World War.
Thank you, Councillor Moxon. Katie.
Yes, apologies. In our framework, our draft framework, we do absolutely talk about the pandemic, and I think we've tried to not put too much information in here, and we have missed that. We should have put that. We've talked about austerity and the cost of living crisis, but we absolutely should have also mentioned the pandemic, which again had a disproportionate impact on many of the groups of people that austerity has had disproportionate impact on, and cost of living crisis as well.
Thank you, Katie. Councillor Wheeler.
If you don't mind sharing, just about, sorry, I know Councillor Carr, you're going, just to make it clear in terms of where we are. So it says on the next steps, number 25, as was already outlined in terms of the year one action plan. So this is the start of the journey, not the end. So it's to get initial feedback now, January to March time when the year one action plan comes into fruition. Obviously, being Tony, your gift chairman, if you want to bring this back or not in the committee, looking further detail, but we do welcome the initial feedback now, and it's, like I say, going to develop in the next few months or so. And the joint needs, the JSNA, as Katie said, went to Health Wellbeing Board. I want to say May, June time, because I sit on that with another hat on, and there's a lot of information there, so maybe worth, the colleagues haven't already, I think the links should be on the online version of the report to have a look at, to see if that answers any other further questions, but then we're happy to come back and discuss it in the future.
Thanks, Chair. Yeah, I mean, I find it hard to critique this item because it's essentially setting out a plan for development and approach for months ahead. But it's right that members, if they feel that something's been left out, then sort of raise it and then we'll bring it up. But it's good to acknowledge that in the report, 15 years of austerity in recent years. Cost of living crisis have exacerbated health inequalities, and it's good for us as a committee to acknowledge that. If you let me finish, I was going to say, with the inclusion of the issue on COVID, so no need to jump in and have a go. But I think it's very important that the future report is a bit more broad or a little broader. But in relation to some of the points raised in the report, I find it interesting in relation to the stories about mental capacity assessments and best interest meetings. Now, there are some members that aren't fully aware what the Mental Capacity Act is, or how to include or do a best interest meeting. So I'd like to suggest that at some point in the future, if there's time, that we have a session on the Mental Capacity Act leading to how to do best interest meetings for members' information, because I think it'd be an interesting thing. There we are. That's right. So it's just trying to be a bit more positive. That's all. Thanks, Chair.
Sure. Does anybody want to come back on that? No. Consideration that we've discussed in this particular item.
Yeah, I think firstly, so the latest version of that appendix is circulated to members with the corrections and the additional information that's been discovered afterwards. That consideration be given to how the committee can carry out further scrutiny work on the development of the framework in the format to be agreed, and that consideration also be given to having a briefing information session for members on the Mental Capacity Act.
Those are the considerations. Note the recommendations have been moved and seconded, and all those in favour. Thank you very much. The programme, and I think we've just got one item to be discussed. Anything else?
Yeah, so the work programme, just to note, obviously it is still quite a new work programme, and there's a lot of stuff on there. There's been some obviously additional information from SAE, but then there won't actually be changes to the work programme. They'll just be worked out. We'll work with officers and the chair to work out how we get these done, but there's no actual additional new items unless anyone wants to suggest anything.
Right, thank you. very much all for attending this meeting. I now close this meeting. Thank you very much.